Welcome. Sorry about that. I was presenting two bills, and I apologize. A couple of these bills are very important and ones that I'm very knowledgeable of, some of the industry, and so I wanted to make sure I was here. Thank you to all the members for your patience. Well, let us begin. We have before us is now Representative LaHood is going to carry 374. And Representative Smith is going to carry 300, so we will have Representative Smith go first.
Thank you, Mr. Chairman, members of the committee. If you look at Bill 300, HB 300, and you've read through it, you'll notice that all this bill does, it changes the name from Continuing Care Retirement Community to Life Plan Community. The Leading Age of Georgia has studied this. They've talked to their stakeholders. They've heard from the younger generation coming up that maybe the term care and the term retirement might not be what they want in their vocabulary. And, it doesn't bother me, but I guess I'm old, But anyway, they've talked about it, and they came up with the term life plan community, and everybody is in agreement, I would say everybody, that is but a term. So I just offer this up to you as a simple bill to make that change. Lead council went through, made all appropriate changes throughout the legislation, and I'd offer that to you today for this change. Appreciate your favorable vote.
Okay, Representative, we have a couple of questions here. First, Chairman Lumsden.
Is this your first bill?
Yes, I'm a freshman. It's my first bill.
Very good, thank you.
Thank you. Yes, sir. Appreciate the question.
Representative Kirby.
Thank you, Mr. Chairman. I've read through this bill, and I know it's not really part of your bill, and going way back to the 13-14 session, we still, I don't think in my mind, have ever straightened out the naming of our licensing levels with assisted living, personal care homes, skilled care, and now we're going to introduce a life plan community. While I agree with what you're doing, and I think this is fine, I don't think that interferes with anything. I think it just wanted to caution you as we go forward. I think we really, for the general public, once we get out of this building, mom and dad need a little help, they say assisted living. And we still have got that as a license level that we haven't really done anything to make that, put that back in the public norm where it was for many, many years. So I'm okay with life plan, but I am just cautious as we move forward with another name.
Yes, sir. And I appreciate it. And I think the right people are in the room. That won't be falling on deaf ears. The right people in the room to hear what you're saying, and they're attending this meeting today. So I appreciate the comments. Yes, sir.
Chairman Benton has a question.
Thank you, Mr. Chairman. Do you have any idea what the cost of this will be for these places to do all this renaming and?
Yes, sir, Mr. Chairman. It's not mandatory. They may change. There are a lot of documents now with the original name on there, but that's just left up to each little community to make those changes. There may be someone here that can speak to that, but that's up to the chairman, though.
Do we have someone who can speak to that issue? Okay. Yeah, go to the podium, please. If you can help with Chairman Benton's question, that would be very helpful.
I'm Jenny Helms, president of Leading Age Georgia, and we represent the not-for-profits. The life plan communities are our members. They want this done because it's what their residents want done. We did send out an email asking if anybody had any issues with it. One asked to please give them some notice so they can get their marketing materials done, but otherwise, this is really what they want.
Okay, well, we have a question from Representative Cannon.
Thank you, Mr. Chair. I have a few questions. I'm sorry, can you please remind us who it was that you represent and how many organizations that is?
Leading Age Georgia, and we are a membership association of the mission-based organizations serving older adults across Georgia. So the whole continuum of care. And the Life Plan communities are our members. I think that we have about 13 Life Plan communities in Georgia. And they have independent living and either assisted living, personal care home, and very small nursing home floors like 30 to 40 for those who age in place in their communities.
Okay, so then, just if I may follow up, I'm having a hard time understanding. I hear that we're saying that this is coming from individuals in the community who are asking for this. I've never heard from anyone who's been begging for the name change. I'm a millennial. I'm not concerned about that.
Yeah.
I'm looking for statistics. I'm looking for information as to why we're doing this. You said, I mean, the bill sponsor said that this is something they may do. What's the point of may doing it?
They're all going to do it. This has been done on the national level. Our national association, which we're one of the members there, all the states are, did a big study to ask residents in what were then continuing care retirement communities how they felt about the name. And they didn't like the stigma associated with it. They didn't like the stigma with retirement. They didn't like the stigma with care. Older adults are getting to be more and more about living well as they age. They want that respect. They want to move away from ageism. This is a move to do that. That's based on the studies, the surveys that they did nationwide.
Okay, so basically just the follow-up question is, can you provide the committee with that information from the national organization, as well as can you provide the information from the state members?
Okay. Yes, but I did give a summary of what came out of our national office when they did it, and I think it's in the write-up, but let me hand that out to you.
Okay.
May I, Mr. Chairman?
Yes, Mr. Bauer. Go ahead.
Representative Cannon, as far as the state part of it goes, it's actually regulated by the insurance department. It's a special niche over there, and we communicated with them, and they're fine with the bill.
And Ms. Tara is passing this information out now as we speak. Lots of questions here, so we're going to continue. Representative Scott has a question.
Yes, good afternoon. I have a question about the beds that are not going. It say in the second year of operation, the Life Plan community should not allow not more than 40% of its beds for new patients, and I see it continue to go down. So, at some point, what are you saying?
Yes,
in the
ma'am.
5th or 6th year, no new patients can come into
Yes,
that
ma'am.
facility?
No, no. Let me back up just a minute. Continuing care retirement communities are not Medicaid facilities, and at one point, and these are facilities where you live independently and then you morph into assisted living and nursing home care as you need it. And you have when you come on campus, you have a reserved spot as you need it. At one point, the Department of Community Health regulations prohibited somebody to come straight from the community to the nursing home. And I guess it was about 10 years ago, Chairman Cooper was overseeing a CON revisions committee then, and I don't know how many of y'all were here. I think Mr. Kirby might have been here, but and because there are more and more baby boomers who are coming to some of these types of facilities, the demand is there to build them, but it's not feasible to build a facility with all three levels of care and wait 7 years or so for somebody to deteriorate, if you will, to that point. So this was a compromise with the nursing home community that you could have that direct admission for the first year. You could have 50% of your beds, and it would decline over 5 years. But anybody's eligible who can basically meet the qualifications financially to buy in.
Thank you, Mr. Bauer. I would ask, just to make sure we're all clear, and we have several more questions, but none of that was changed in this bill.
No,
This
no,
is
sir.
this
That-
is just
that was the cross-reference to the CON section,
right,
because
I
the
just
term
wa-
appeared there, and I
right.
should
I
have
just
pointed
want to
that
make
out.
sure that we're
Yes.
clear for everybody that
Yes, thank you.
what is a continuing care
Yes.
retirement community today. In not one dot or one tittle has
Correct.
been changed in the authority and what they can and cannot do. This is simply a name change.
That's
Is that
correct,
correct?
Mr. Chairman, and I
Okay.
should have
Just
pointed
want-
out what she's reading is a cross-reference section.
No, I
And
just wanted to make sure we all are
thank-
aware
Thank
of
you
that.
for making that clear.
Sure. Yes, sir. All right, we have a question from Representative McLeod.
Okay, so I want to ask a couple of questions. One is, why do we need to do a law if the Insurance Commission and the Department of Insurance was willing to do it?
It's more of a marketing thing, and actually, we thought this bill was going to go to Chairman Smith's insurance company and committee, and he asked the same thing, and Marty Wilson, who is his legal counsel there, said it was necessary as well.
It was necessary?
Yes.
Just for the marketing purposes?
No, the change of statute, because the statute
Okay.
says that.
And I have another question on, thank you, Chairman. On line 30, I think it's 30, it said, payable in a lump sum or lump sum and monthly maintenance charges or installments. Is there a reason why lump sum was stated twice?
I think that's what is in current law, and I don't know if it was, if it's an oversight in terms of that, but as Chairman Petrie said, there's nothing, no requirements are changing at all. That's a cross-reference section where the term continuing retirement community is used, and so that's the only reason that section is in there. We would be more than happy to, whoever wants to get together at a later date and explain the whole concept of CCRCs to you. But as the chairman says, this is just a name change.
Okay, thank you. Representative Gilligan has a question. Representative Gilligan.
Thank you. Thank you very much. Where is the author? Hi. Hi, Mr. Author. I was just curious, are there any state agencies that will need to change their websites to point to the right thing? And since this is optional, is there any requirement or way to make sure that we're pointing not to a 404 page not found?
I'm always wondering what that thing is.
I couldn't, legally, I can't answer that, but I can, Tom
You
may
can
can, or
answer
Les
that, Mr.
counsel that
Bauer?
drew it up.
I don't think there's any cost. It would just, where it says continuing care retirement community on the insurance department website, it will say life plan community. I think the only change would be, and Mr. Kirby was mentioning the levels of care and who can use assisted living as a term. There's no restriction here, so you can keep using the term continuing care. And I think the only thing would change is the internal documents for the contract with the resident, and that's just a matter of changing it in the computer and running off a new document.
So my clarification is just to ensure that we are not driving the public to pages that are no longer there. Is there a state agency that anybody knows of that should indeed update their websites?
The
And
Department
is-
of Insurance will update, I'm sure, to say Life Plan Community. So, but we work with them, and they're fine with the bill. So,
And we have a couple more questions, but I just want to emphasize related to Representative Gilligan's question. So right now, all of the individuals that are involved with regulating these particular facilities that are continuing care retirement communities, just like any other facilities, skilled nursing facilities, personal care homes, assisted living communities are regulated by HFRD. Y'all are under the authority of
That's
the Insurance Commissioner's Office. So
That's
the
correct.
name would be changed as the state officially sees those licensed entities. And
Correct.
the private sector can call themselves whatever
Sure.
they choose, just like in the personal care home industry. You know, you may be you may call yourself senior care or assisted living, or you may call yourself personal care.
Can't say assisted living.
Well, you can't say assisted living if you're a personal care home. That's correct. But so there's all kind of options that are available to the private sector, is my point. Those options would remain open.
Yes, sir.
But the state is going to see you, license you, and expect you to be held by the statute that is currently a continuing care retirement community and would be, under your proposal, a life plan community.
that's
All right.
correct.
Thank you, sir.
Well
All right,
put,
we
Mr.
have-
Chairman. Thank you.
Let's see. Yes, sir. All right, we have a question. Is 18? Okay. My seatmate has a question. All right.
Well, Mr. Chairman,
Representative
you just cleared up my question. I was just confused that we were using two terms, not eliminating a term, but adding a new term. But it sounds like from what you just said, it's going to be changed to, from a state perspective, only life plan communities. Is that
That
correct?
is my
So we're-
understanding. Okay. Thank you, Representative. All right, Representative Robichaud, 16?
Yes. No, I am 16.
Yeah, I had pressed, yours had been pressed longer, I thought. I'll come back to Bazemore. Wait, who's 16? Okay, Representative Robichaud.
So, along those same lines, just as I read it, the previous continuing care retirement community were exempted from the state health planning and development plan done under DCH, so that stays in place too. So it's all the same issues.
Yes, ma'am. Yes, ma'am. That was the sheltered beds that I was.
Right, the sheltered beds, that's where it's a little bit different, but it's the same that has been in
No new
existence.
rules, no new.
Right, correct.
Okay, Representative Bazemore,
Okay, you have 17.
17.
It was on. Thank you, Mr. Chair. Just a quick question to circle back around. I don't know if it was answered, if I missed it, but the cost to change all of this locally and with the websites and different entities, because I do know, like, now we are a city and people have in stores and things a different name and they have to change everything. So that's my question to you.
Well, with the amount of people that wanted to make this change to go away, they'll pay for their own cost and make the change. Now, the ones that want to stay exactly like they are now, they're fine, but like they said, at the state level, it will change, but it's not mandatory.
Just by way of example, there's a checklist that the department sends to each community when they renew their license. So the checklist will probably say checklist of items for CCRCs. It'll now say for life plan communities, but that's not a big cost. That's just a matter of,
Mr. Chair, follow up. I'm just trying to get an understanding. So the state is making the changes, but the cost is minimal, I'm hearing, or non-existent?
I don't want to say non-existent, because I think if you have a series of documents, legal documents that you have to change the title of, there's probably some minimal cost to that, but.
Okay. Thank you.
Okay. All right, do we have a question, Representative? Cannon, I think we've got legislative counsel coming to help y'all to understand. So let's do that and let me ask a question in the interim. Good. Okay. Okay. I wanted to ask this, Ms. Ryan. Do we, the entire industry that are continuing care retirement communities in Georgia, are there multiple associations that represent those, or is everyone on board with this desire to change the name, pretty much, the industry across the board?
Everyone is on board. We do share
Okay.
some members with Georgia Healthcare Association.
Okay, very well.
Yeah, are members of both.
But there's no
We've heard of no
trade
opposition.
association that is opposed.
No, and we sent
Okay.
out an email to every member, every life plan community, and say, if you have any issues, let us know. And only one responded with, please give us advance notice, enough notice to get our marketing materials changed. They wanted the change. They just said, we just need a little notice.
Gotcha. Thank you. Okay. Yeah, I want to. Yeah. Okay. Well, we're still working on that issue over there. Let's hear from. We have Mr. Skin Edge has signed up to speak with Georgia Senior Living. No. Oh, next bill. I'm sorry. Oh, GHCA. Okay, Russell. Yeah, thank you. Yeah, I didn't see Russell hiding back there.
No,
Thank you, Mr. Carlson.
Yes, my name is Russell Carlson. I represent the Georgia Healthcare Association, which represents the skilled nursing facilities, the nursing homes in the state. We're a component of CCRCs in the sense that, the actual nursing home, if you will, within a CCRC does kind of come into to our territory, if you will. I will say that Ms. Helms with Leading Age, one thing that might maybe kind of shed some light on the exercise itself, changing the names, is, for example, just listen to how I opened. I mentioned skilled nursing facilities and I mentioned nursing homes, and the same is true to state code, where I'll be in one particular setting, like I believe this bill does refer to skilled nursing facilities. But then sometimes I'll be in a different, whether it's a judiciary setting or something like that, I'll be in another hearing looking at statutes that cite nursing homes. So there is some value, I think, in uniformity, just something to consider. And I do appreciate any attention that you're giving to costs and the burdens. That's always appreciated. It was expressed to us by Mr. Smith and Ms. Helms that this will not be mandatory in the sense that everyone needs to change their signage overnight. That was obviously something that our membership asked about. But it will be incumbent on us to meet the market needs, where if everyone's calling it one thing, then we might want to, change our materials to reflect that. So as you contemplate the legislation itself, I thought it might just be valuable to bring up my kind of what I see daily between skilled nursing facility and nursing home. So.
Very good point. Thank you, and thank you also to Ms. Helms. Is there anyone else that wants to speak to this bill that's here today, whether you've signed up or not? Okay. It is the proper time. We have a motion and a second. Any discussion? All in favor? Aye. All opposed? Okay. It's
Thank you, Mr.
unanimous.
Chairman.
Thank you, Ms. Second. Okay, I didn't, it wasn't flashing. Okay, is there a, Vince, will you no, actually, Vince, if you could just tell me what did we discover? It wasn't flashing. What did we discover? Is there a typo? Representative Cannon. So you're concerned about making it more clear?
They feel like it'd be more. They feel like it'd be clear to have a period there instead of an or. But so these things are saying this. It does say this.
I think I understand now. Okay. Okay. Our vice chairman is going to make a motion.
Thank you, Mr. Chairman. I make a motion that we move to reconsider our action on House Bill 300 for the purposes of looking at an amendment prior to due pass.
Second. All in favor? Aye. Aye. Okay. All right. Now, We are going to, oh, you hang on. No, we're gonna let, all right, let me turn this off. All right. Representative Cannon, if you would explain the clarifying language you were recommending.
Comma. That is the amendment. On line 30, after the word some, striking the word or, and adding a comma. There is no second piece to it.
After charges.
We may as well do one there, otherwise we miss Oxford. That's Oxford, we don't have a comma there, so I guess we have two.
Nothing further is needed on that or. The sentence would then read payable in a lump sum, comma, lump sum and monthly maintenance charges, or in installments.
Mr. Chairman, can I address
Let
that?
me, let's hear from Mr. Bauer.
Mr. Chairman, I see what the problem is now here. There should have been a comma after lump sum, the first lump sum, because the current law, and we're not trying to change anything, says that you're either going to put down a lump sum or a lump sum in monthly maintenance charges or in installments. So you're unintentionally changing the intent of the law, I'm afraid, if you do this. It was only our intention to have a name change, not to.
No.
Yeah.
What you're saying, though, what we're doing is clarifying what is currently.
What I'm suggesting to you is if you put a comma, are you putting a comma in and that's all you're doing?
Correct.
Okay.
Yeah, there
Got
was confusion by several members as to exactly what
I'm sorry, I
this
missed it.
sentence
Okay.
meant.
I
And
got
the
it.
goal is not to change, that's why I was being very cautious.
Okay.
The goal is that we can't even put a comma that changes what the statute allows
yeah.
these facilities to do.
I misunderstood.
But
If you're-
only that it's more understandable. I hope
Right,
that's
yeah,
where
and-
we're getting.
And
So
obviously, you're getting help from Lake Council, so
that's
I
why
apologize.
I'm looking to Vince over here first. Okay, so does that do it? I think if we can keep it in that, it's a lot better. You think it still works? Okay, gotcha. Okay, all right. So does everyone understand the amendment? Pretty simple. Okay. Do we have any? We have a second, right? Do we have a second? I thought we did. Okay, Ms. Robichaud. All right. We need a motion. Okay. Any conversation? All in favor? Aye. Any opposed? Okay. Now, do we have a motion do pass as amended? Okay. Any discussion? All in favor? Any opposed? All right. We just changed the name and made the statute better. How about that? Thank you, Representative Cannon. Sharp eye. All right, very good.
Thank you very much.
Thank y'all. Thank y'all for being here. Okay, let's go to House Bill 374, which will be carried by Representative LaHood. And if ever there was an appropriate member to carry this bill, it is Representative LaHood with his experience in these matters. Yeah, and if you would, Representative, clarify the LC number, because we have a substitute, is my understanding.
That is right. Thank you, Mr. Chairman and members of the committee. What I'm presenting today is a committee substitute to House Bill 374, the LC number being 337784S. It should be in your folder.
Here it is.
And so what this bill is intended to do Well, let me back up a little bit. An assisted living community was created a few years ago by the legislature. Rules were then written to regulate this level of licensure. One of the main intents of this new level of licensure being created was to allow a resident in this setting to age in place as their needs changed, so they would not be forced to move into a more restrictive institutional-like setting against their will. And so that's working well, but one of the snags that we've run into is the administration of certain medications, in this case liquid morphine, to a hospice patient within an assisted living community. For some time, certified medication aides who practice and administer medicine within an assisted living community were administering liquid morphine to hospice patients until about a year and a half ago, the Department of Community Health determined that those certified medication aides were not acting within their scope to do so. So what we've done here, and what that's caused, is these hospice patients in the last days or hours of life, oftentimes to wait long periods of time to get the pain relief that their physician has ordered for them. That's what this liquid morphine is for, pain relief. And so what we've done is brought all the players to the table, including Department of Community Health, who's here in the room. We've brought the senior living associations. We've brought the hospice associations. Other providers have all spoken to this, and we've come up with some language that we all feel like will work well and will provide the safeguards that are needed, and to make sure that nothing is being abused. There's plenty of hospice oversight built into this bill. There's a limited number of volume of the product that will be allowed on site. The licensed hospice provider will administer the first dose to observe the patient, make sure there's no adverse reactions. And then after that, the assisted living community staff, who are certified medication aides, will only be administering this medication when hospice is not available. So there'll be plenty of contact and correspondence going on between the facility staff and the hospice provider, and a very narrow window of time when this will even occur. But the result will be these residents of this residential setting will not have to wait long periods of time to receive the pain relief that their physician has ordered. I'll be glad to take any questions.
Representative, if you'd do me a favor first, for all the members, would you make sure that everyone here understands, because we just talked about what were CCRCs and still are today. Now we're talking about assisted living communities. There are personal care homes, and then there are skilled nurse facilities. So if you would do me a favor to make sure all the members are aware, explain exactly how an assisted living community differs from a personal care home and a skilled nursing facility. I think that'd be helpful.
Great question, and thank you for asking. So prior to, I believe it was 2012, assisted living communities did not exist. What you had was personal care homes that were licensed by the Department of Community Health, and you had skilled nursing facilities, which Russell referenced a few minutes ago. And out there in the free market, like Representative Kirby mentioned a few minutes ago, if you're a consumer and you're looking for a place to take care of your aging parent, for example, what do? You Google assisted living a lot of times. And what you expect to find is any licensed facility that may be appropriate for your mom. Well, one of the unintended consequences of the legislation that created assisted living communities a few years ago was that we legally defined the term assisted living, which restricted the use of that term in the industry's marketing material to only a licensed assisted living community. And what it did was it left out personal care homes who had been marketing themselves as assisted living facilities or communities for forever. And so that's a separate issue from the bill I'm here to present, but it is something that might be helpful for you to understand. The difference in a personal care home and an assisted living community is mainly two things. One, an assisted living community is allowed to admit and retain a resident who cannot self-preserve or who is non-ambulatory, who cannot evacuate a building in an emergency all by themselves. And the second distinction is that an assisted living community can administer medications by employing and training certified medication aides, whereas a personal care home can assist with self-administration of medications by employing and training proxy caregivers. If anybody wants to correct me on any of that, I'll feel free. But that's where we are. An assisted living community is just another layer between a personal care home and a skilled nursing setting, designed to give consumers more choice so that they can age in place in the setting that they prefer. And all we're doing here is making a way for these residents to receive the pain medication that their physician has ordered in a timely fashion, in a very restricted, safe way.
Thank you, Representative. I think that was helpful. The way you described that, it is the level of care between a personal care home and a skilled nurse facility, so it is a more acute population. Thank you. We have a question from Representative Kirby.
Okay.
Thank you, Mr. Chairman, and I appreciate your explanation. And I think looking at some of the faces, this is still an issue we haven't resolved that we still sure like to take up. But on your bill, we're talking about liquid morphine. How is that administered to the patient?
It's drawn up in a syringe, and it is administered under the tongue, sublingual, to a patient that, like I said, most of the time is in the last days or hours of life.
So we've got some intelligent person at DCH that putting something in their mouth is not oral administration, so we've got to do something different than oral where they're already allowed to do.
The question was whether this required clinical judgment beyond the ability of the certified medication aid.
And I'm not fussing you, but we've already got in law that they can administer oral medication under the doctor's care. And we're still going to administer oral medication, just somebody's decided, well, this one's special, so we're going to make some other rule. Is that, so therefore we got to change the statute, is what you're telling us?
The department may want to speak to that, but more or less, the department did determine this after several years of this happening.
Thank you.
Yes.
And we will probably want to hear from the department in a moment, and they can answer for themselves. We have Representative Cannon has a question.
Okay.
Thank you, Mr. Chair. I'm trying to understand on line 61, it's at the end of it. After the word "as needed" in quotations is PRN. Can you tell me what that is?
Yes, PRN in the medical world is what we say for an as-needed medication. So sometimes the doctor will order a blood pressure pill to be given BID, which means 2 times a day. But for medicines such as pain medication, it might be ordered PRN, which is as needed when certain signs or symptoms are manifesting.
Thank you. And so just a follow-up question then. So the person who would then be able to give this, what is the title? I'm sorry. The
liquid morphine?
Medication aid.
Oh, yeah,
Okay.
certified medication aid.
So the medication aid would then be able to administer the morphine. And then it says between lines 64 and 66 that then the licensed hospice healthcare professional would address those adverse reactions. So my question ultimately is, if a medication aid read on the page, they should be administering a certain amount, and then they administered that certain amount, but then they felt as though via the grimacing, restlessness, or groaning that they wanted to give something different than what was on that order. Does this allow them to do that before a licensed healthcare professional, hospice professional, makes that decision?
If I understand your question correctly, the certified medication aid will not be allowed to administer any medication unless the physician has ordered it. And in the case of this liquid morphine, they can only administer that after they have received approved training by hospice, and after hospice has administered the initial dose to make sure this patient didn't have any adverse reactions. Does that answer your question?
I believe it does. That medication aid would not be able to change the amount that was written there when they're
Correct.
administering. They would be doing what
Correct.
was already. Thank you.
Yes. The certified medication aid will simply be following a written order.
Thank you.
Representative, this essentially is hospice training a proxy caregiver to allow the staff in an assisted living community to administer this morphine. Isn't that correct?
Training a certified medication aid.
It's training a certified, I use the term proxy more liberally, but
Right.
yes, it is training a caregiver to do this under an individual that is under hospice and then is trained by hospice leadership.
Right.
Skilled staff.
That's
or,
right.
medical professionals. Thank you. We have a question from Representative McLeod.
Thank you, Chairman. I want to ask you, when you have the syringe filled with the morphine, is it being administered, like they have to just push it down their throat, or is it a needle? How is it being administered?
Good question. I should have specified no needle, no
Okay.
injection. It's just basically squirted or
Okay.
administered under the tongue, and it's absorbed very rapidly, sublingually.
Okay.
Good
Thanks.
question. Any further questions of the sponsor? Okay, there being none, we do have some folks that want to speak to this bill. Let's begin with the department, if we could, because I think we had a question here from Representative Kirby. So if the department will speak. And then we'll go to Mr. Edge and Ms. Casey and others that may want to speak. Thank you.
Good afternoon. I'm Brandy Sylvan, Director of Government Affairs with the Department of Community Health. And I certainly want to start by thanking Representative LaHood and Chairman Petrie and bringing us to the conversation early on so that, we could sort of express our concerns in ensuring that this is done in the safest manner possible. With regards to your question about if this is an oral medication, why was the department having concerns with it? And it has to do with this being a medication that requires that clinical judgment. So it needs that assessment both before administration and after administration of the medication to see if the dosage is appropriate and to ensure there are no concerns with how the patient is reacting to that medication. So that is, and part of this legislation is exempting this from the Nurse Practice Act because morphine currently can only be administered by RNs. So it was something that we just didn't want being done outside of a controlled environment.
Thank you. Any questions for the Department of Community Health? Okay. All right. Right. And my understanding is we have a meeting, an insurance committee meeting at 3, so we're going to try to go quickly. Mr. Edge?
Thank you.
Would you like to?
Mr. Chairman, we just appreciate your support of the committee on the bill. I know the time is short.
Okay. Ms. Casey? Thank you. And Ms. Sanders?
We appreciate the support. The only clarification I'd like to make is this is a practice that happens for patients who are in the home. I represent the Georgia Hospice and Palliative Care Organization. So if a patient lives in a private residence, this activity would be their family members would be administering this medication.
Right.
That exactly in the same way. So it's just trying to replicate that home experience that we expect and have allowed within that assisted living environment. So again, appreciate the support. Thanks for your time.
Well said, Ms. Sanders. We're trying to allow people to age in place, I think is what you're saying. And Certainly that was the intention of assisted living communities. Is there anyone else that wants to speak to this bill? Okay, yes ma'am, Ms. Helms. Thank you so much. Okay. All right, unless there are any questions, what is the will of the committee? Motion do pass. We have a second. Any discussion? All in favor? Any opposed? Okay. This bill is passed unanimously. Thank you all for being here today.